Good morning. Thanks for joining us today. My name is Dr. Greg Vigoren. I'm a practicing dentist here in Newport Beach for the last 4 decades. And I want to go over a number of small issues, answer some questions. One of them is about cost value. Another one is about how do we prevent the cost and get the most value out of our teeth without having to pay for it. And it will involve holes and cracks, and it will involve how do you teach the entire family how to prevent dental disease so that you don't have to go into the costs. Question about costs. So when you talk about cost, you can't really separate that from value. And cost is really the price that you pay divided by the durability, the time that it lasts. And it's also about when it fails, or if it fails, or if it has to be redone. Is it minor to recover, or is it catastrophic? And we want to avoid, one of the principles is we want to avoid catastrophic failures, because to need a root canal or to extract a tooth or need an implant or need a bridge, those are catastrophic failures and they're expensive. All procedures in dentistry are unique to that person. They're all one of a kind. They all involve skill, care, and judgment. And in my opinion, very strong opinion, they require fine motor skills, high magnification, and understanding of what to do and what makes restorative dentistry or fillings or crowns or bridges or implants or any of the procedures that we do, what makes them durable, what makes them last, what makes them more valuable than doing something that's on a billing code reimbursement from a third party who doesn't care if you're wallpaper in a rental union in Philadelphia. And I don't live in Philadelphia. So outcomes matter in evaluating value and evaluating cost. And so when we talk about the cost of any goods or services, generally from the least expensive to the most expensive, throwing out the extremes, the bicycle that doesn't work for an hour and an exotic racing bicycle that they use in Tour de France, there's a bell-shaped curve of cost from maybe $1,000 to $6,000 for a bicycle that you could ride on for years, or you could take across the country in a bicycle ride. And it's the same thing with cars, from the least expensive car to the most expensive car, throwing out all the exotics. There's a 5x difference. In bicycles, there's a 10x difference. In food and lodging, there's a 5 to 10x difference from the least expensive to the most expensive. And in dentistry, there's also a bell-shaped curve. One of the inherent problems in dentistry with insurance and reimbursements is they have been putting a drag on actual fees for 60 years now. And the problem with that drag is it keeps profit, and then people figure out how to do something for less, and the quickest way is to do less for less. And so we see durability and predictability going way down in restorative dentistry from what the available lifespan of well-done crowns, veneers, implants, bridges, root canals, fillings are. So don't get too caught up in what the actual cost is unless you understand what the actual values are that you're supposed to be paying for. And in this case, you should be paying for durability and predictability, aesthetics. Everything's got to look good. So everybody is an aesthetic dentist who does anything is worth their weight. And avoidance of catastrophic failure. And I can't claim to bat 1,000, but when you follow these guidelines of magnification, of understanding, of motor skills, and of doing the very best thing that you can for your patient, in other words, treating them like family or friends, close friends, who you're going to have to treat for the rest of your life for free, you do the very best things that you can. Okay, so that covers reimbursements. I haven't gone into third parties, but when the government starts paying for something, or your insurance company starts paying for something, they have an inherent interest in lowering costs. And unfortunately, that interest isn't counterbalanced with benefits to the patient, long-term outcomes, and predictability. Speaking about reimbursements and the effect that reimbursements have had on dental costs, I want to bring up Canada as an example. Canada for years had basically free health care. But the way that they had free health care is they rationed things, and the safety net or the relief valve for that was, if you wanted to go to the head of line or get a surgery done, or something that you would normally in the United States get done in a week, a 3-month or a 6-month or a 2-year wait in Canada was normal. Well, the safety valve is you could go across the border and pay cash and have it done in the United States by very, very competent practitioners. Well, we've kind of lost that now. In dentistry, when they introduced insurance, they covered a fair amount of our fees, and the annual limit, which was an inverted stop loss, they only paid X amount instead of after X amount paying 100%, which they had in medical insurance. They inverted the stop loss, and that stop loss of $1,000 to $1,500 hasn't moved in over 60 years. So 60 years ago, you could buy a Volkswagen for about $1,700, and now that same Volkswagen is about $27,000, and yet the reimbursement is the same. And so our costs have been suppressed from an insurance reimbursement standpoint, but that has to have affected quality and decision-making that dentistry uses, and it's affected the outcomes. We are going through a similar evolution right now in healthcare. It used to be that the carriers paid what the hospitals and what the doctors charged. And when Obamacare came in, and we had Medicare, what people didn't realize is they gutted over 90% of all the procedures that they used to pay for, and they stopped paying for them. And so when everybody got universal health care, what they got was they got a hollowed out plan. And anybody that hasn't used healthcare thinks it's still the way it used to be, but anybody that goes through the system now realizes that there are limitations, significant limitations in treatment that they can do, and it affects. I've had doctors apologize to me for members of my family and myself that they couldn't do what they could do before because of limitations from the federal government reimbursements. And then once the federal government steps in, then the carriers, the private insurance companies, tend to go along with the cuts in services. So healthcare is going through the cuts in services and the reimbursements that dentistry went through 60 years ago. And the people who continued to give high quality care in dentistry stepped out of plans, contract plans, where you had to do what they said for what they said. And you're seeing the same thing in healthcare now. All the evolution of concierge healthcare, where the doctor can't make enough on the reimbursements from third parties, and so they step out of the system and they treat patients for non-insurance, basically cash purposes. Cracks and holes again, or pits and fissures, as I like to call them. In dentistry, we name the most common type of decay class 1 decay. And it's class 1 because it occurs in almost all humans. And these are the developmental holes in the tops of the teeth and the chewing surfaces, primarily in the back teeth. And these holes become infected if there's any disease-producing bacteria anywhere in the family. And so it generally gets transferred from your parents who have untreated dental disease in their mouths. When you turn your back on your 3-year-old or your 2-year-old and they pick up your toothbrush and do what you do with it, they stick it in their mouth, or in feeding, or from siblings. So these holes, these natural developmental pits and fissures, or holes and cracks, they harbor the bacteria that causes dental disease, both periodontal disease and decay, the damage of hard tissue and the damage of soft tissue. And every time you take your toothbrush out of your mouth, these are like the caves in Afghanistan with Al-Qaeda. As soon as you go away, they come back out and they repopulate the whole mouth with the same disease-producing bacteria. You are like washing the top half and never rinsing off your feet or your legs when you try to take a shower or when you try to get clean. And it's an ongoing problem, and there's a very simple solution to it. When someone gets their very first teeth at age 6 or 7, you can seal them with sealants. It's very popular for the last 60 years, and they just cover up these holes and these cracks. The problem is it's a short-term solution. 50% of those fail within 3 to 5 years. And so even though they cut down, they're not very predictable. We do, in my concept, and I think in a lot of people's who have thought this out, you seal teeth on a 7-year-old so you don't have to anesthetize them, and it can be done by an assistant. And then by the time they're 12 years old, their mouth opens, they can cooperate more, they can understand more. And at that stage, quadrant by quadrant, or a quarter of the mouth at a time, we go through and open those up with a micro burr, and we bond those shut. And it's the most durable filling that we do. And I have those in the mouth for over 45 years. And those patients have little or no dentistry in 40 to 45 years. No decay in between the teeth, no periodontal disease, no decay in their mouth. So it's highly, highly effective at stopping tens of thousands, $50,000, $80,000, $100,000 worth of dentistry over a lifetime. And that's a pretty significant savings per child. My recommendation is that sealants are done at age 7, and pits and fissures are done age 12 to 14 to 16 when all the permanent teeth are in. And it stops future decay and periodontal disease very, very effectively. And we can go through the lectures that I've been giving for 40 years on this topic and that I've taught at major dental schools all across the country. And if you want to see more or hear more about pits and fissures and this very powerful preventive method, go to my website and you can see examples of these teeth in lectures that I've done. And, I'm happy to discuss this with other dentists, with your dentist, or with other dental schools. And it's a change that dentistry needs from a preventative standpoint. There is nothing that we could do in dentistry that would lower the overall cost of dental disease over a lifetime than obliterating completely these holes and cracks, these pits and fissures in young people's teeth. Thank you very much.